Since 2010, South Africa has made remarkable progress. HIV infections have dropped by more than 40%, and millions of lives have been saved through broader access to prevention and life-saving treatment.
We are the country most affected in the whole world. I don't like that tag, but it's there, it's a reality, it's living with us. And so at the moment, we are having 5.9 million people on ARVs. We're not very proud about being number one in the world. And for that reason, we want to be proud to be number one in fighting the disease, right, to reverse what has happened.
However, the fight is far from over. HIV remains one of the world's most pressing public health challenges.
Of course, as a sector of people with HIV, we are worried. We were frustrated as well. We are worried, especially with the withdrawal of PEPFAR, because really this whole process could reverse the gains.
Are the most vulnerable, underscoring the urgent need for renewed global solidarity and support.
Over the past 13 years, we have been suffering with civil unrest despite the 14 years of celebration. As a result of this, high levels of humanitarian needs affect a large population, and also girls and young women particularly are vulnerable to HIV infections.
Recent funding cuts, particularly from major donors like USAID, are sending shockwaves through health sectors worldwide. These financial shortfalls threaten to undo years of progress and put countless lives at risk. Without sustained funding, health systems, especially across Africa, risk collapse, and previous gains could be swiftly erased.
I think when we're thinking about the impact of those funding cuts, including HIV, we must just remember that HIV isn't just a disease. It's a disease that in itself, if untreated, exposes individuals and populations to many other diseases. So it has a row of skittles effect.
The UNAIDS report urges governments to act fast by reallocating resources, reinforcing national health systems, and partnering with the private sector to plug critical funding gaps.
The report torches what is happening, what has happened this year, that the sudden withdrawal of the single biggest HIV donor, combined with other cuts of aid from other governments that were happening more gradually, is putting this progress at risk, particularly for the low-income, highly burdened countries.
The road ahead is tough, but it's not impossible. With committed leadership and collective action, African nations can hold the line and ensure that no one is left behind in the fight against HIV. In Johannesburg for News Central, Bongani, Siziba.